Hi, I'm Mr Joe Marais, ENT consultant at Clementine Churchill Hospital in Harrow. Today I'll be sharing my knowledge about having a septoplasty, which is a type of nose surgery that can help you breathe better. I've performed this operation many hundreds of times in my career, so you can count on me for an expert information and advice about the procedure. What is a septoplasty? First things first, a septoplasty is a surgery to correct a deviated nasal septum. Your nasal septum is the bone and cartilage that separates your two nostrils. It's around 7 centimeters long in adults. A deviated septum happens when the bone and cartilage become crooked or off-center. This can cause a number of issues related to your breathing. Most people won't notice you have a deviated septum, and surgery is primarily performed to improve the symptoms that a deviated septum causes, not the physical appearance of the nose. What causes a deviated septum? A deviated septum can be caused by various factors. Causes include physical injury to your nose from contact sports or accidents. Even minor trauma that goes unnoticed at the time can cause your septum to become misaligned. Some people are born with a deviated septum. During childhood and adolescence, growth spurts can cause your septum to develop abnormally or become misaligned. The natural aging process can also cause changes in the nasal structures, potentially leading to a deviated septum over time. Surgical procedures on your nose, such as those intended to correct other nasal problems or cosmetic surgeries, can sometimes result in an unintended deviated septum, which will need to be surgically repaired. What are the symptoms of a deviated septum? The main symptoms of a deviated septum include nasal congestion, in other words, a stuffy nose or blockage, which is often more pronounced on one side of your nose. You will also have trouble breathing through one or both of your nostrils. This might get worse with exercise or when lying down. A deviated septum can also cause noisy breathing or snoring during sleep, potentially leading to sleep disturbances and, in some cases, a reduced sense of smell. These symptoms can significantly impact daily life and overall quality of life. How does the septoplasty help your breathing? By straightening your septum, septoplasty effectively opens your nasal passages, allowing for better airflow through your nose. This improved airflow can alleviate symptoms such as nasal congestion, difficulty breathing, chronic sinusitis, significantly enhancing your ability to breathe. Additionally, for some people, septoplasty can reduce snoring and improve sleep quality, which further improves your overall energy levels and quality of life. How do you prepare for a septoplasty? Preparing for a septoplasty involves several important steps. First, you'll consult with your surgeon to discuss your medical history, any medications you're taking, and any allergies you may have. Your doctor may advise you to stop taking certain medications, such as blood thinners, aspirin, and non-steroidal anti-inflammatory drugs a week or two before the surgery to reduce the risk of bleeding. It's important to stop smoking ahead of surgery, as smoking can impair healing. You'll be asked not to eat anything for around 6 hours before coming into hospital. This includes chewing gum and mints. You'll be also asked not to have anything to drink except clear fluids, such as water and black coffee, for 2 hours before coming into hospital. Make sure you have someone to take you home after surgery, because you'll be under general anesthetic for the procedure, which means you'll be asleep throughout. It takes up to 24 hours for this to wear off, during which time you won't be able to drive because you'll be feeling groggy and out of sorts. What happens during the procedure? The operation usually takes about 30 to 45 minutes. You'll probably be asleep, that is, general anesthetic. Your consultant will make a small cut inside your nose and either remove or straighten the bent cartilage using specialist instruments. You'll have some small dissolvable stitches left inside your nose. These are broken down and fall out over time by themselves, so you don't need a follow-up appointment to have them removed. What is the recovery process like? Most people recover within a month after surgery. You'll most likely go home on the same day. We may give you some nasal drops or spray to help with your breathing, as well as an antibiotic cream to take home with you. As I mentioned, there will be some stitches inside your nose, but these will dissolve and usually fall out by themselves. You'll need to take at least a week off work to rest as much as you can and allow your nose to heal. Your nose will be a bit painful for a week or so, but paracetamol and ibuprofen should be enough to keep the pain at bay. For 2 weeks after surgery, breathe gently through your nose and do not blow or sniff, as you could increase the swelling. If you're going to sneeze, try your best to sneeze with your mouth open to protect your nose. Avoid lifting weights or doing strenuous exercise, as this increases the swelling and risk of bleeding. Irrigation of the nose with saline to dislodge any dried, crusted blood is important. Gentle blowing of the nose is encouraged to help clear this debris, which reduces the chances of infection and adhesions. Decongestants can be used to aid this. So what are the success rates? This operation is highly successful, with more than 90% in alleviating a blocked nose in patients with a deviated nasal septum. We hope this video provides you with the information you need to understand this surgery and how it can significantly improve your breathing. If you have any more questions, feel free to leave them in the comments section below this video. If you'd like to arrange a consultation with me, or the nearest consultant in your area to discuss this surgery in even more detail, you can book an appointment at circlehealthgroup.co.uk.